So this report published by the UK Lung Cancer Coalition today is called Bridging the Gap, and it's around health inequalities in lung cancer. So we know lung cancer is the leading cause of cancer death. And in order to improve outcomes, we need to drive towards earlier diagnosis. And that is certainly coming with the advent and the recommendation from the National Screening Committee around CT screening programs, which we hope will be enacted across all 4 nations in the UK. But as well as that, we know that there are considerable disparities in health inequalities across the UK between different groups of people. Now, we have some information about some of these health inequalities, but generally, we don't have a lot of information about a number of different areas. And in order to improve outcomes, we've got to tackle issues on multiple different fronts, as it were, not only developing CT screening, but actually also people coming into the system, making sure that we are addressing all of the issues pertinent to that individual. So we know, for instance, that socioeconomic deprivation is significantly associated with lung cancer outcomes. And we've got quite a lot of data on that. We've got some data on ethnicity, but there are probably a number of other areas where we don't have very good data and information. And what we're calling for in this report is essentially we need to find ways of improving that data and information about individuals, because if we know more about that person and how these potential inequalities may affect them and their journey through the lung cancer pathway, we can then potentially intervene and help people and help communities and improve patients' journeys and ultimately hopefully improve their outcomes. So, for instance, we don't have an awful lot of information about ethnicity and different ethnicities. We don't have an awful lot of information about certain populations, such as LGBTQ groups and individuals, about travelers, about people with mental health issues. There are lots of different areas, people from different religious backgrounds, people who have different social values. This is obviously the rich panoply of the population in the UK, and obviously this applies probably globally, but we're just focusing on the UK here. So what we want to do is try and enrich our knowledge of individuals when they are first referred with suspected lung cancer for investigation, and make sure that if we've got more information about that person and these issues as may pertain to them, we can then, as I say, help them and make sure the right things are in place, which hopefully will improve their overall outcomes.